Thank you. And at this time, I'd like to introduce former Senate Majority Leader, Dr. Bill Frist, and BPC Senior Fellow as well, who will provide some opening remarks.
Thank you, Anand, and thanks to the staff at the Bipartisan Policy Center and our partners at GTM RX. Today, we've come together to discuss a timely topic. COVID-19 has taken too many American lives. It's halted our economy, it's interrupted our social connections, and it's overwhelmed our healthcare system. Masks and social distancing continue to be fundamental to our toolkit to help reduce our risk of being exposed to the virus and of spreading it to others. But now we have the game-changing tool that will accelerate our efforts to end the pandemic: vaccines. The 3 FDA-authorized vaccines are safe and effective. Vaccines are the miraculous final piece in the puzzle to help us to return to work, to return to play, and to engage in everything in between. Vaccines will save lives. We see an encouraging uptake in vaccinations as vaccines become available to more Americans at no cost. But we are only at the beginning of the road. We have a moral imperative to work as hard as we possibly can and as quickly as we can to reach herd immunity. To get there, we must continue to build confidence in COVID-19 vaccines. And here is how we do it. First, increase trust. Vaccine hesitancy is nothing new. As a doctor, as a physician, I've witnessed some type of hesitancy on vaccines with my patients for over 40 years. But what's new is that many Americans have concerns specifically about the COVID-19 vaccines. Their concerns typically center on the vaccine development and on the approval processes. And throughout the pandemic, public trust in the scientific community has unfortunately decreased. Compounding this, some Americans express skepticism because COVID-19 vaccines received FDA approval faster than many other vaccines in the past, thanks to emergency use authorizations. Moreover, many Americans feel the vaccine approval process has been politically motivated rather than driven by science. In fact, recent polls just from March show that the largest single divide among Americans in their support for vaccination now falls along political lines. The truth is this virus does not discriminate based on political affiliation. Building trust and confidence in vaccines has got to transcend politics. We can increase trust by leading with the facts. And the facts are that the 3 FDA-approved vaccines met the agency's rigorous scientific standards for safety, for quality, and for effectiveness. Those are the facts. We must remove the political undertones in these conversations in order to improve trust, in order to increase the uptake of vaccines, and to reduce preventable deaths. All Americans who can get the vaccine should, regardless of political affiliation, get those vaccines. Number 2, we must leverage public and private partnerships. These partnering connections are integral to successfully building confidence in COVID-19 vaccines. The COVID-19 pandemic is a public health threat that is too great for any one company, any one institution, any one government department to solve alone. So like all other COVID-19 response efforts, building trust in vaccines requires this inclusive, this all hands on deck approach. We need to make the decision to get vaccinated as easy as possible for Americans. We've got to meet people where they are. Employers and businesses and faith-based organizations play hugely important parts in getting people vaccinated. As they are the ones, those institutions, those faith-based organizations, those employers, those businesses are deeply embedded in communities all across America. And public-private partnerships also help us use all resources to get the gettable. These institutions can help take active measures to encourage employees and community members to get vaccinated. One example, faith-based organizations could partner with state health officials to serve as vaccination sites, or they could provide transportation to those vaccination sites. Employers might offer employees paid time off for the time involved in going to get that vaccine. Vaccination, you see, is not just a win for public health, but we know that businesses are going to benefit too. Ultimately, vaccination plays a large role in getting us to herd immunity and fully reopening the economy. Finally, we must incorporate the medical neighborhood in our strategy to build vaccine confidence. We think of hospitals, we think of healthcare professionals, we think of all the others who provide healthcare services who are actually in the communities. All of those are critical to building trust in the COVID-19 vaccines. As a doctor, I know firsthand the amount of trust Americans put in the medical neighborhood, the neighborhood around them, the ecosystem around them each and every day, to care for themselves, to care for their children, to care for their loved ones. There is no more important time than now to tap into that trust and to build confidence in COVID-19 vaccines, as well as vaccines of the future. You know, we have a great panel of experts today that will go into much greater detail about the role of these medical neighborhoods in building vaccine confidence. And I'm excited for the conversation. Thank you all for joining us today.